the herb is smelly, bad taste, and everything. Now, when you first started the herb, how do you find all this taste of the herb?
No,
having cooking and all
that
that.
time there was a necessity to take also.
Yeah.
Because I know I want to improve myself. So I took it, no problem. Right?
You have no problem with
I got no problem with
the
that.
smell,
No problem.
and the cooking part also no problem.
It's a very, very heavy smell to take, you know. My daughter there is horrible, the smell.
But about the chores of having to cook and all this?
It's very tedious. If at home, I don't mind.
Yeah.
The thing is, she's about to retire.
Yeah.
I'm already retired.
Yeah.
We only think of going overseas.
Yeah.
You know,
Yeah.
that is our main problem. Brewing the herb.
Okay.
So I want to ask you,
Yeah.
what is the solution?
Oh yeah, there is
All
a...
help us enjoy our life.
Yeah, correct. Well, there are two ways.
Okay.
One, of course, is like you just need to buy a small rice cooker
What really?
and then you plug it. That's it.
It's the smell.
Well, you stay in a hotel room. Now you are so used to the smell of even the room is flooded with
They're afraid
that.
of neighbors complaining.
Oh,
I think
yeah.
the hotel won't allow.
Huh?
If it's coffee, aroma, then nobody will complain.
Yeah.
If it's a herb,
Next thing, if you cannot, you just packet it into little packet.
Then put hot water in.
So what you do is you buy a thermoflask, you put a hook inside, and then every morning for breakfast, ask them to put hot water, really hot water in it, and you just keep it there. Meaning you soak the thing for maybe 2-3 hours. Don't drink straight away. Just leave it like that. So in the evening you can just drink. That is better than
Not
nothing.
going for holiday.
Not going for holiday or doing nothing. Nobody can predict what is going to happen. Unfortunately, well, you might be good today. I do not know what is going to happen in the next 5 years from now if you do not do what you are doing. This is the thing that we have to, it's common sense. If you are doing well now, that it makes sense for you to say that, well, since I'm doing well now, I'm not going to do what I'm doing. Does it make sense or not?
No.
It doesn't make sense.
You must continue.
Yeah, and then somebody say, well, I want to stop my herb. I cannot tell you no, you cannot do. But I think it doesn't make sense. Because I know at the end of the day, cancer cannot be cured. It will come back. Now, one good example, which I don't want to be an example, but it just happened, is this lady. I call her Nancy. I wrote in a book about her story. She believed that she knows everything. So, after 5 years of taking the herb, without chemo, nothing, she told me, I'm very cured.
How did she know she went to check up?
So don't want to take anymore. Just disappeared totally. So it's okay with us. Because I asked you to continue the herb. You think I'm trying to make money out of you people. So I said, okay. I mean, it's your life. It has nothing to do with me. Huh? 14 years later, my wife got a phone call. The cancer came back after 14 years.
She must have been eating.
14 years. All the bone gone.
Huh?
Eaten up all the bone.
You.
Spots everywhere. And last month I got an email saying that my mother died. No, it taught me that 20 years is still not a cure. I had 14 years, my auntie 13 years, came back. So if someone is 5 years and say that he's cured, I think he is done. But you cannot, it doesn't go into the head of many people, unfortunately. Okay? So, back to you again. I mean, be aware of this. If you are doing well, the only thing, the most sensible thing is just continue doing what you are doing. I mean, why go change? That nothing anybody can do, really to prevent anybody from getting a recurrence. Accept that person. Okay? If he take care of himself, that's it. But if he doesn't want to take care of himself, too bad that he knows already. Well, that's what he wants in life. So be it. The most sore point is the food, the diet. We tell people to take care of the diet. How do you cope with the diet? Are you taking care of your diet?
Very well.
Are you take care
Only just now, only recently, I take a bit of fish.
A bit of fish. Yeah, that's fine. You take care of your diet properly, you follow the diet chart. Now, this is entirely different from your old lifestyle.
Yeah.
Now, do you rebel? Are you angry?
No,
Are you?
I settled already.
Huh?
I love my beer so much, I will stop drinking my beer already.
So there's no more complaint.
No more
The
complaint.
thing
No
that you
beer
love so
already.
much, you can give up easily.
No beer.
Or you like to drink beer?
Yes, I stopped. I totally stopped.
His beer kaki is there.
And then you also stop.
Stop totally.
What about your friends? Do they feel that you are dumb?
No. I go tell them my problem.
Huh?
I got this problem.
Yeah.
I cannot take.
Yeah.
They accept.
Oh, they accept. So you are not odd then to them.
No.
Huh? So they push you
No, they won't.
to say hi, a
No,
bit
no,
of
no.
one glass makes no difference?
Only
No.
thing is that now I change my diet like this.
Huh?
My present bosses
Huh?
don't invite me for dinner anymore.
Oh, they don't invite you. So you lose out for dinner.
They don't invite. Because the moment if I go to join the dinner,
Yes, vegetarian.
I will be vegetarian.
Yeah.
I order my vegetarian food.
Yeah.
Their wives must be watching me, you know.
Yeah.
They may ask me a lot of questions about this diet, you know.
Yeah.
So next time they'll kena. They can every day. So that's why they don't invite me anymore.
You become a nuisance, troublemaker.
Because they saw me, how do you eat like that?
Ah,
How do you eat like that? They say, yeah, I'm enjoying it.
yes.
My
They don't want to give up. Yes.
Then of course they enjoy it.
So the only way to give up is to get the wife to pressure them. Okay? And the wife will come and correct from
No,
you.
that's why they don't need to meet the wives. The wife don't meet me.
The worst trouble is,
I got a book called The China Study.
China study.
Yes.
Yeah.
I passed it to him, you know.
Huh.
You look at it, I said, I know it. He's scared after reading it, he can eat all those things.
See the China study. Okay. Were you under pressure at any one time when you started this?
No. On the spot, I changed my diet.
You changed on the spot.
On the spot.
Just switch off like that.
yeah.
Can
Okay, what made you able to switch off like
I
that?
mean, I got to take care of my health.
Huh.
This is my own body. If I don't take care, who's going to take care? I can always jury behind her to eat the meat or that one.
Yeah.
I don't do it. Because I know this is my body, my health. I need to take care. This is my brain is telling me. So I can see all this now. You can see sucking pigs. My favorite seal yolk.
Huh.
Smelly.
Chow chow, I don't think.
Very smelly.
Okay. It is all about human being.
You mean the mind actually what they want. Actually.
Cancer is about human beings.
That's right.
And I realized this years ago. And then I always tell people, if you cannot change, there's nothing I can do.
Yeah, that's right.
The fact that you learn that this is the way that you have to go, change your diet. You just accept it with
So you win, no problem.
no protest.
No problem.
You don't curse me for that.
No. The only thing is that the regret was a bit regret the first 1 week or 10 days. Walk in the supermarket, this one cannot eat, this one cannot eat, this one cannot eat, this one cannot eat.
Left, right,
What do you eat? What do you eat? But now I learn already. You go to restaurant and say, I'm vegetarian.
Yeah.
Can you recommend me something?
Yeah.
So they all eat what they want. I order the vegetarian food.
Food-wise, it's okay.
Okay. So you can accept that. So if I were to tell you, okay, now you are 5 years already, go back to your old diet.
No.
Would you go for it?
No, no.
I don't think so.
You don't want to go for it?
No.
I won't allow him to do it.
No, I don't think so. Because that is a thing you realize that cancer is a recurrent thing. So you want to control, you must control all through.
Okay, that's for you.
Yeah.
But about you, do you follow the same diet?
80%.
I'm 80.
Huh?
80% follow me.
I still take a little bit of meat,
Yes.
fish.
Okay, fair enough. So you also realize that.
Yeah.
Now, after you change your diet, do you feel there's any change in your health?
Oh yes, suddenly slim already, you know. Wow.
Now,
Yeah.
do you realize that it helped you or not?
It helps.
Do you think you feel you're healthier?
Yeah.
Okay. All right. I say everybody has a diet.
Yeah.
Let's realize it. Nowhere you can go to any place where if we talk about that, because that is something that people is a taboo, don't want to listen, don't want to talk about.
Yeah.
But here, I purposely tell you that don't worry about dying because everybody is going to die.
Yeah.
And for example, don't get excited because I too, 72, may die anytime.
Yeah.
You don't have to worry about dying. Okay, this is a reality. Important thing is you can eat, you can sleep, you have no pain, you can move around. Now what else do you want? There are patients that who write to me that they say my mother was talking, and then she's just dying.
Oh, that's good.
Yeah, I say fantastic. You're laughing, and suddenly all the brain come and I die. He said, thank you very much. I say very good. Another one went to bed. The next morning never wake up.
Okay, that's good.
Wow, I say I'm so happy to hear that. You know, because a lot of people suffer before they die. But fortunately, I think one of the things that we have done, which I thought was great, is that many people when they die, they don't suffer.
Yes.
Some bloated stomach like that, but for us, our patients, no. They just die very clean, normal, which is, I think, is fantastic. So we talk about good death.
Yes.
You know,
That one good that not everybody can get. You must do a lot of good deeds and get this sort of result.
Yeah. Yours is another story that I'll be putting up. I'm going to cover your face
Yeah.
so that people don't know who you are.
Yeah.
But your story will be there.
Yeah. Never mind, I show my face also never mind.
Never mind.
Okay.
Yeah, then okay.
I
But
gotta share my
it's very
face.
helpful. A lot of people will go to him to talk about his cancer.
No, I'm very, from ethic point of view,
Yeah.
I cannot just not close it unless someone say no, do not do it.